the last 50 years in the United States, we have seen rapidly rising rates of chronic illnesses throughout the entire body, the body and the brain: infertility, obesity, type 2 diabetes and prediabetes, Alzheimer's, dementia, cancer, heart disease, stroke, autoimmune disease, migraines, mental illness, chronic pain, fatigue, congenital abnormalities, chronic liver disease, autism, and infant and maternal mortality, all going up. Americans live 8 fewer years compared to people in Japan or Switzerland, and life expectancy is going down. I took an oath to do no harm, but listen to these stats. We're not only doing harm, we're flagrantly allowing harm. While it sounds grim, there is very good news. We know why all of these diseases are going up, and we know how to fix it. Every disease I mentioned is caused by or worsened by metabolic dysfunction, a word that it is thrilling to hear being used around this table. Metabolic dysfunction is a fundamental distortion of our cellular biology. It stops our cells from making energy appropriately. According to the American College of Cardiology, metabolic dysfunction now affects 93.2% of American adults. This is quite literally the cellular draining of our life force. This process is the result of 3 processes happening inside our cells: mitochondrial dysfunction, a process called oxidative stress, which is like a wildfire inside our cells, and chronic inflammation throughout the body and the gut, as we've heard about. Metabolic dysfunction is largely not a genetic issue. It's caused by toxic American ultra-processed industrial food, toxic American chemicals, toxic American medications, and our toxic sedentary indoor lifestyles. You would think that the American healthcare system and our government agencies would be clamoring to fix metabolic health and reduce American suffering and costs, but they're not. They are deafeningly silent about metabolic dysfunction and its known causes. It's not an overstatement to say that I learned virtually nothing at Stanford Medical School about the tens of thousands of scientific papers that elucidate these root causes of why American health is plummeting and how environmental factors are causing it. For instance, in medical school, I did not learn that for each additional serving of ultra-processed food we eat, early mortality increases by 18%. This now makes up 67% of the foods our kids are eating. I took 0 nutrition courses in medical school. I didn't learn that 82% of independently funded studies show harm from processed food, while 93% of industry-sponsored studies reflect no harm. In medical school, I didn't learn that 95% of the people who created the recent USDA food guidelines for America had significant conflicts of interest with the food industry. I did not learn that 1 billion pounds of synthetic pesticides are being sprayed on our food every single year. 99% of the farmland in the United States is sprayed with synthetic pesticides, many from China and Germany. And these invisible, tasteless chemicals are strongly linked to autism, ADHD, sex hormone disruption, thyroid disease, sperm dysfunction, Alzheimer's, dementia, birth defects, cancer, obesity, liver dysfunction, female infertility, and more, all by hurting our metabolic health. I did not learn that the 8 billion tons of plastic that have been produced just in the last 100 years, plastic was only invented about 100 years ago, are being broken down into microplastics that are now filling our food, our water, and we are now even inhaling them in our air. And that very recent research from just the past couple of months tells us that now about 0.5% of our brains by weight are now plastic. I didn't learn that there are more than 80,000 toxins that have entered our food, water, air, and homes by industry, many of which are banned in Europe, and they are known to alter our gene expression, alter our microbiome composition and the lining of our gut, and disrupt our hormones. I didn't learn that heavy metals like aluminum and lead are present in our food, our baby formula, personal care products, our soil, and many of the mandated medications like vaccines, and that these metals are neurotoxic and inflammatory. I didn't learn that the average American walks a paltry 3,500 steps per day, even though we know based on science in top journals, that simply walking 7,000 steps a day slashes by 40 to 60% our risk of Alzheimer's, dementia, type 2 diabetes, cancer, and obesity. I certainly did not learn that medical error and medications are the third leading cause of death in the United States. I didn't learn that just 5 nights of sleep deprivation can induce full-blown prediabetes. I learned nothing about sleep, and we're getting about 20% less sleep on average than we were 100 years ago. I didn't learn that American children are getting less time outdoors now than a maximum security prisoner. And on average, adults spend 93% of their time indoors, even though we know from the science that separation from sunlight destroys our circadian biology, and circadian biology dictates our cellular biology. I didn't learn that professional organizations that we get our practice guideline from, like the American Diabetes Association and American Academy of Pediatrics, have taken tens of millions of dollars from Coke, Cadbury, processed food companies, and vaccine manufacturers like Moderna. I didn't learn that if we address these root causes that all lead to metabolic dysfunction and help patients change their food and lifestyle patterns with a united, strong voice, we could reverse the chronic disease crisis in America, save millions of lives and trillions of dollars in healthcare costs per year. Instead, doctors are learning that the body is 100 separate parts, and we learn how to drug, we learn how to cut, and we learn how to bill. I'll close by saying that what we are dealing with here is so much more than a physical health crisis. This is a spiritual crisis. We are choosing death over light. We are choosing death over life. We are choosing darkness over light for people and the planet, which are inextricably linked. We are choosing to erroneously believe that we are separate from nature and that we can continue to poison nature and then outsmart it. Our path out will be a renewed respect for the miracle of life and a renewed respect for nature. We can restore health to Americans rapidly with smart policy and courageous leadership. We need a return to courage. We need a return to common sense and intuition. We need a return to awe for the sheer miraculousness of our lives. We need all hands on deck. Thank you.
We're not letting you off that easy. I've got a couple questions. So you outlined some basic facts that doctors should know, yes, that truthfully you could cover in 1 hour of an introductory class in medical school.
Yes.
So why aren't we teaching doctors these things?
The easy thing to, is it on? Yeah. The easy thing to say would be, follow the money. That sounds sort of trite. But frankly, I think that is the truth, but not in the way you might think, that like doctors are out to make money or even medical schools. The money and the core incentive problem, which is that every institution that touches our health in America, from medical schools to pharmaceutical companies, to health insurance companies, to hospitals, doctor's offices. They make more money when we are sick and less when we are healthy. That simple one incentive problem corrodes every aspect of the way medicine is thought about, the way we think about the body, We talked about interconnectedness. It creates a system in which we silo the body into all these separate parts and create that illusion that we all buy into because it's profitable to send people to separate specialties. So it corrodes even the foundational conception of how we think about the body. So it is about incentives and money, but I would say that's the invisible hand. It's not necessarily affecting each doctor's clinical practice or the decision-making. It's corroding every lever of the basics of how we even consider what the human body is and what life is.
So in your book, you do a really good job of describing how, because of the specialization of medicine, you don't see the forest for the trees. The fact is, you do need specialized medicine. I mean, doctors can't know it all. So I think the question is, how do we get back to the rewards for general practitioners that do focus on, what you're writing about?
Yeah. I have huge respect for doctors, and I am incredibly grateful for the American healthcare system, which has produced miracles. And we absolutely need to continue to have primary care doctors and specialists, and they should be rewarded highly. However, if we focused on what everyone here is talking about, I think we'd have 90% less throughput through our healthcare system. We would be able to have these doctors probably have a much better life, to be honest, because right now doctors are working 100 hours a week, seeing 50, 60, 70 patients, and could actually have more time with patients who develop these acute issues that need to be treated by a doctor. But so many of the things in the specialist office are chronic conditions that we know are fundamentally rooted in the cellular dysfunction I described, which is metabolic dysfunction, which is created by our lifestyle. So I think that there's always going to be a place for specialists, but so much fewer. And I think if we had a different conception for the body as interconnected, they would also interact with each other in a very different way, a much more collaborative way. And then, of course, we need to incentivize doctors in the healthcare system towards outcomes, not throughput.